Let's see another question. What is the most likely diagnosis for the 65-year-old male patient based on the given information? A. Chronic obstructive pulmonary disease. B. Bronchitis. C. Pneumonia. D. Acute respiratory distress syndrome. E. Asthma exacerbation. There are two correct answers for this question. A. Chronic obstructive pulmonary disease, COPD, and E. Asthma exacerbation are the correct answers. A. Chronic obstructive pulmonary disease, COPD, is a likely diagnosis based on the patient's history of smoking and asthma, symptoms of shortness of breath, wheezing, and cough, chest sounds congested with wheezing and crackles, and elevated pulse rate. B. Bronchitis is not a likely diagnosis as the patient's symptoms, such as shortness of breath, elevated pulse rate, and low blood pressure, suggest a more severe condition than just bronchitis. C. Pneumonia is not a likely diagnosis as the patient's chest sounds congested with wheezing and crackles, which is not a typical sign of pneumonia. D. Acute respiratory distress syndrome, or ARDS, is not a likely diagnosis as the patient's ABJ results, pH 7.25 and PSCO 250 do not meet the criteria for ARDS. E. Asthma exacerbation is a correct answer as the patient has a history of asthma and is showing symptoms of wheezing and shortness of breath. The physician's order of nebulization and bronchodilators also supports this diagnosis.